Welcome back, everyone. Dr. Shayna Keller, naturopathic doctor. This morning I'm on with Dr. Dianna, who is a biologic dentist out on the East Coast, and we are going to talk about mouth health and how it pertains to systemic health, the body, especially the gut health, because that's kind of my area of curiosity into the medical world. So something that's new to me, and I'm really curious with what Dr. Dianna has to say on this, are tonsil stones and enlarged tonsils being associated with reflux potentially. So I'm putting a question mark there. Sleep disordered breathing is not just sleep apnea. Oral microbiome and the gut microbiome and how those play a role with each other. I like to think about it north to south, and a lot of people forget about digestion starts in the brain actually, but technically the mouth if we're being specific. So Dr. Dianna, can you share a little bit about yourself?
Yeah, sure. Hi, everybody. My name's Dr. Dianna Cortese. I was born and raised in New York City, in Brooklyn, and now my husband and I live in upstate New York. And yes, I'm a biological dentist. I went to NYU dental school. I did a residency, a general practice residency in a hospital. I also had experience working in dental oncology, and I worked at a cancer hospital doing that. Now I'm a practicing dentist, and I also I am involved with a research paper right now. Can't give too much info in on it, but it's about pretty much like the connection between certain metals in your body and certain diseases, and yeah.
That's important. There's some interesting metals, aren't there? And we can go on a tangent into hip replacements, metal on metal, but we'll stay on topic here.
Okay.
So thanks for sharing, Dr. Dianna. That's really great. I didn't realize you had so much background in oral oncology. But that's pretty interesting. So what can you tell me about how people can take better care of their mouth to prevent some of those oral cancers?
Yeah. So the basics first, just keeping good oral hygiene, brushing, flossing, especially. It also really matters the products that you're using too, especially if you're using mouth rinses with alcohol in them. That actually has been shown to be associated with oral cancers, increased risk. Making sure you're being mindful of if you drink alcohol or smoke cigarettes, that can also be a risk factor. And now there's a ton of research showing that the connections between oral bacteria and the progressions of certain cancers. And as a biological dentist, we kind of see, even more in depth of what the association with oral cancer is, and certain toxins and things like that the mouth can be exposed to. There's also an emotional, spiritual connection sometimes with the mouth and certain organs, and
Sure.
and types of cancers. But yeah, making sure that doing meditation, whatever kind of just helps calm your mind, and yeah, those are
There
also important.
For sure, very important. And the mouthwash thing, it seems to be getting more traction, people paying better attention to it. God, marketers are brilliant. They sell us crap that we don't need, that we think we need because we want to have clean breath, but we don't even need fresh. You just need to disrupt that biofilm, that gunk on your teeth, so that you can get rid of the excess bacterial overgrowth. Is that right?
Yeah, kind of. I think with a lot of the marketing, sometimes it's a little deceiving because they're like, yeah, you can kill 99.9% of bacteria. And it's like,
Right.
hold on, that's like pretty much taking an antibiotic once or twice a day, however much you use
Right.
mouthwash. Sometimes even natural mouthwashes too, like certain essential oils, they're really strong. So you have to be really careful and speak with your dentist about if that would be helpful for you, maybe certain, things. But there's actually a lot of really good bacteria that live in your mouth too that are helpful for many different functions. For example, there's bacteria on your tongue that produce nitric oxide, which is a really important molecule to help keep your blood vessels nice and healthy. So if you're constantly just washing that off every day, that might not be the best thing for
Right.
heart health and things.
For
So,
sure. Yeah, nitric oxide. So let's chat about that briefly so people are on the same page with us. Nitric oxide is not only in our respiratory, we have tissue that responds to nitric oxide in our respiratory system, our nose especially, but also in our genitals. So it helps us. So if you have taken Viagra, and anybody that's taken Viagra knows that they get stuffy noses with it, it's because that tissue is responding. So if you want to have better sexual performance, better sexual health, it might be wise to consider not using mouthwash anymore, because you are destroying the nitric oxide producing bacteria in your mouth, which, the nose and mouth have similar friendship because of the oral pharynx, the back of the mouth that they share. God, so fascinating. Marketing. Yeah, see, everything kind of is connected. You're affecting your mouth health, and it affects in a downstream effect on your sexual health. And how many people are dealing with sexual issues? A lot. You didn't think that this was going to go there.
Yep.
Okay, so what about tonsil stones and enlarged tonsils? This is a new thing I've recently heard, an association with people having reflux, but more on the silent side. And the symptoms that show up then are tonsil stones and enlarged tonsils, which what do? We generally cut them out and say, oh my gosh, they're causing collapsed airway restriction. And I mean, it's a scary thing. So what have you seen in your practice? Have you seen any association?
Yeah, well, sometimes it's not really like proven from my understanding that there's a cause and effect between GERD and tonsil stones. However, people who have GERD are more likely to have tonsillitis or just issues of the tonsils, right? Inflammation. It might be because of like the acid coming up that's irritating the tonsils. It could be because of something with like lymphatic drainage. So what that means, if you're not sure what that is, so your tonsils are pretty much like the filtration system for like the waste in your head and neck. So sometimes if that gets clogged or something like that, overloaded, that can contribute to tonsil stones. Sometimes stones are pretty much, it's kind of like a kidney stone in the way, like it's like a calcification. So some research shows that like it might be related to just your systemic health. Like, why are you getting more calcified, calcifications in your body? That could be something you see somebody like you, Dr. Shana, or somebody who works with like gut health. Another thing, there's a lot of research showing it's related to oral hygiene. And if you have poor oral hygiene, you're more likely to get tonsil stones. But I've also seen people with really, really great oral hygiene come in and they still get tonsil stones. So
totally.
Usually there's something like systemic going on. But the basic stuff, we kind of rule out, right? Also, how's the lymphatic system in your head and neck working? Usually,
right.
Going to somebody who does lymphatic drainage or just kind of taking a look at you and seeing how things are flowing. Those can all be beneficial things for tonsil stones.
Absolutely. So like a lot of things in medicine, we don't know. And a lot of things that in my practice as well is the same. It's like there's very rarely there's one thing that causes the thing. It's like a multitude of things. It's like 10 years of sleeping like crap, eating like crap, drinking too much. And it's just like, oh, then you had to take a bunch of antibiotics because you got a kidney infection. And then it's just like a stacking effect of like, now we have to come back through the woods and come back to where we were prior to all of those things being so detrimental to our health. And then let's add that the person got periodontitis because they weren't brushing at any regular intervals, which I see pretty regularly actually. How do you address that? Because that's something I've recently had a more common finding in my practice of people, specifically with ADHD. I know that's not what we were talking about, but people with ADHD having a hard time remembering to brush their teeth. I ask about brushing and flossing. And consistency is all I care about. No one's perfect, but...
So are you asking like how to help people stay consistent? Is that?
Yeah. Have you had, because, this is what you do, right? So how have you found, because I'm sure you see people that have hyperactivity issues, get a little off track from time to time.
Yeah, I guess it really depends on the age. If it's like kids,
these are adults.
Okay. So I'll stick to adults then.
Yep.
So what I do, this is like a hack that it literally changed my life, because sometimes, and everybody's guilty of this, right? Like late at night, you just worked a long day. The last thing you want to do is just right before you go to bed is to brush your teeth, floss, do all these things because you're already really tired anyway. So what I like to do is, maybe like 20 minutes or so after I eat, Then I'll brush my teeth. And then what I'll do is just say I'm reading a book at night before I go to bed, or watching TV, or whatever your routine is.
Mm-hmm.
Just keep the floss right on your coffee table or like your
Mm-hmm.
nightstand. I know it sounds ridiculous, but it's so much easier to just reach over and to to floss then.
For
Um,
sure.
so just keeping just little flosses around everywhere, just making it convenient for yourself.
Yeah.
Even just setting an alarm. I mean, if that's what
Yeah,
it takes,
for
right?
sure.
And habits usually, like, the more, after you do for several weeks, it just becomes a habit, and then
Right.
you
It
get
like
used
feels good. It's like, oh my
to
gosh, I
it.
didn't get to floss. Yeah. That's definitely an approach I've taken. I use herbs quite a bit in my practice, and people always have such a hard time taking it, but they remember to take a pill, but because it's a liquid extract that they have a harder time. I don't know. It's interesting. I'm like, okay, put it in your bathroom. Then you take it when you're getting ready for bed and when you're getting ready for the day. Put it someplace you see. Well, I don't like clutter. Well, if it's out of sight, it's out of mind. I'm that way. So I keep things on my coffee table for sure. So this is just one more tip then that we can apply practically to our lives so that we can improve our health just incrementally. I love that. Okay, so sleep apnea. I can't tell you the number of patients I've seen that have like weird sleep studies, and now they're just doing these like pulse ox things where they look at the oxygen saturation in your finger throughout the night, which I don't feel like that is, those are imperfect devices and they're kind of chintzy, most of them. But I guess it's better than going to a sleep center, I guess. But okay, now you're borderline, you don't have sleep apnea, you don't have central sleep apnea. Sorry, there's nothing wrong with you. But you're having oxygen issues, you're having symptoms related to, what I would typically find with someone that has undiagnosed sleep apnea. Cue sleep disordered breathing. It's a whole spectrum like most things in
Yeah,
medicine. Can you tell me a
exactly.
little bit about sleep disordered breathing and how that shows up for you as a dentist?
Oh, yeah. So I think, well, before, I guess in conventional and dental school, they don't really teach you about it. It was actually, I started working for a dentist, and I started noticing, I guess because he was trained in it, so it kind of helped me open
Mm-hmm.
my eyes to it. So I took the sleep training course, and it was, once you can see the signs and symptoms in the mouth, it completely changed the way I practiced,
Mm-hmm.
because the majority of people I've seen have something related to sleep apnea, whether it's
Yep.
related to their health or their dental health. So this is a pretty big rabbit hole. But anyway, I'm going to stick to dental. There's a lot of medical conditions, especially like heart conditions,
Yeah.
that can be affected by sleep apnea, and even obesity. There's just so many. That's a
Yeah.
whole other
That's why it's so
topic.
important to have this conversation, because there are so many people out there that are struggling with sleep issues that are not sleep apnea, but no one's really paying attention to this arena. And I'm glad it's seeming like it's gaining a little more traction, mostly with dentists is the primary group of people that I've seen talking about it. So I love, yeah, we're going to keep to the mouth, but it's affecting quality of life across the board for humans.
Yeah. So, I guess when you think of sleep apnea, you really think of just like heavy snoring, and
Mm-hmm.
that's what most people think of. But that doesn't always have to be the case. A lot of people, when they're growing up, right, and I think there's a lot of different factors, such as like air quality, the quality of our food.
Yeah.
Um, there's a lot of different factors, but anyway, sometimes the structures of our jaws and the structures of our airways get compromised, so they become
Mm-hmm.
smaller. And there's a lot of different controversies of like what's actually causing that, but whatever it is, right? Once you're an adult, you got a certain jaw structure, your teeth, right? Um, but in general, I guess the trend in the last few hundred years, at least, is that everything is shrinking, right? So just think about it. I'm
Right.
sure yourself, how many people get braces nowadays, right?
Pretty much everyone.
Yeah, lots of crowding, and that used to not be the case so much.
Mm.
And Weston Price, his book is really great about, um, like, and then there's a book called Jaws. I forgot the guy's
Jaws.
name there. That's a really cool book, and if you want, maybe we could like link it at the end or something.
Oh
I
yeah,
haven't.
cool. That would be good.
Yeah, but that's a really basic book. You don't have to be a scientist or anything like that to understand it. It's really made to help understand why our jaws get to be the way they are.
Mm.
Anyway, long story short, so sleep apnea, usually it's could be related to soft tissues in your throat, tonsil, that kind of area, the back of your throat collapsing.
Exactly.
Yeah. So like, for example, snoring can be from your tongue kind of making a flapping noise in the back of your throat at night. But sometimes it's, it's not just the soft tissue. Sometimes people literally just don't have enough airway space. Their airway is very small, or there's nasal congestion, nasal blockages. There's a lot of different conditions that even if you don't have severe sleep apnea, there's actually a spectrum. So with sleep apnea is like the worst of the sleep issues. And then within that, it's like mild, moderate, and severe. But then there's a whole other spectrum that's, okay, you don't have sleep apnea, but we know that your sleep quality is not that great. There's still some hindrance in your breathing. So there's a bunch of different conditions that you could have that's the other way too, which I usually find more common, especially in women. Women about our age, I would say. A lot.
Interesting.
Very fit women. It's very, very interesting. People who are, very fit, seemingly healthy people too, which is very interesting. But, so what I usually see, some signs and symptoms in the mouth, you could have a very narrow palate. The airway is very small. There's certain types of scans you can get to really check in depth all of the different dimensions of your airway and like, are you getting, so there's lots of different ways to test. But technically they don't like the sleep community doesn't really treat unless it's technically sleep apnea.
Right.
There's a lot of other things that you could do even if you're not technically diagnosed with quote unquote sleep apnea. But that really depends on the dentist and like, looking at this, like what is actually the issue? Is it your nose that's clogged? Is there deviated septum? Is there is it an airway issue? There's so many different ways to go about it.
Right.
Also, I think just in general, following good sleep hygiene, making sure the basics too. It might not be sleep apnea. It could just literally be like, are your shades? Do you have blackout shades? Are you sleeping in a regular circadian rhythm? I mean, there's just so many things.
Are you eating a handful of candy corn? I don't eat a lot of candy, but I do love candy corn, and you got to have the Brock's candy corn because it doesn't taste the same otherwise. And God, I ate a handful of that and I was like choking on my own spit. It was just like gross. And so how many people eat something to that effect, and that is then affecting our airway and our breathing? And that's what you're kind of getting at. Like, let's not forget the basics. The basics are still important. Yes, we can go these high level things and do expansion, palate expansion surgeries for some people that have really severe narrow palates. This is where like making sure your babies, they're when they're sucking on a binky, that it's an appropriate one for their palate, or appropriate so it doesn't cause the narrowing palate. Or do you subscribe to certain binkies are better than others?
I guess a little bit.
Okay.
I think the main thing, especially with young kids, is just kind of, try to eliminate the habits that we know specifically can cause narrowing of the airway, right? Like thumb sucking, prolonged thumb sucking, things like that. But then as they get older, when you monitor, like for me, this is the approach I take. I kind of monitor them. And then if I see that they're starting to show signs and symptoms of technically getting sleep apnea, there's a lot of things that you could do to like help prevent that from happening and to help the structure of the jaw grow properly. So there's some oral devices that you can use. Cool. And then there's a lot of like lifestyle things. Like let's talk about diet. Let's talk about their sleep. I really go in depth. We have like a sleep meeting with every single kid and their parents, and like that's something. It's so important. So
I love
again,
it.
it's not just the diet or just this. Sometimes it's not the diet. Sometimes it's just
everything.
Just there's so many different influences. Yeah.
Yeah, staying on your phone. Like, I know I'm guilty of this too. It's like staying on your phone a little too long, staying on the screens a little too long. And man, sure enough, if I do turn them off, I sleep so much more soundly. Like, and I know it, I say it, and it's just like, we're all human and we all have these, like, I'm feeling lazy and tired after a long day. Like, I'm just going to veg for just a little bit longer instead of turning the TV off and like getting ready for bed a little bit sooner and reading before bed, right? Like, I want to normalize that we're all humans and no one is expecting perfection. But the more that we hear the same thing over and over again, the more we're like, okay, maybe there's some truth there. I'm going to do a little self-experimenting. That's kind of the approach I take with folks, is to encourage that like curiosity and say, hey, when I did this, this happened. When I did this, this happened. Interesting. Maybe it's worth it to continue eating the candy corn. It really wasn't. I threw the bag away after a couple handfuls of that. I was just like, I can't. Don't do that. I don't need that. Okay. So you're saying spectrum of sleep disordered breathing, it gets missed because sleep apnea is the worst, but there's other variations. What about teeth grinding? That's something I hear, oh, everybody's got parasites. I actually think sleep grinding or teeth grinding is much more associated with disordered sleep behavior or sleep issues than maybe. I don't know. It's a whole can of worms, but.
Yeah. So I guess the thought with grinding is, so grinding could be from a lot of different things. Sometimes some medications that could be a side effect, right? So it's really important that you talk to your dentist and they kind of go through a checklist, like, okay, let's make sure it's not this, right? But I find a lot of the time it really has to do with sleep disorder breathing. So the reason that is, so at night, besides your diaphragm, right, because you got to breathe, but all the muscles in your body kind of just shut off and relax, right? Rest. That includes your jaw muscles. So your lower jaw, which is your mandible, at night, everything kind of relaxes and it drops back. Okay. Yeah. So what happens when your lower jaw drops back, especially if you have that narrow, tiny little airway, if you have a lot of extra fat tissue in the back of your throat, whatever the cause is, or if you're having trouble breathing out of your nose, there's so many different things. But whatever it is, what will happen is, if it's kind of like a reflex that your body's like, okay, I'm not getting enough oxygen, but I'm going to jolt my jaw forward like this.
Like in CPR.
Yep. That's literally what I always use that analogy.
Yeah.
So you jolt your lower jaw forward in order to get that oxygen. So a lot of doctors think that it might be related to like not getting enough oxygen, and you're kind of just like jolting your jaw forward reflexively to help you breathe at night.
Right.
And a lot of the times you don't even notice you're doing it because you're sleeping. And right. And like you said with the CPR relationship, just in case anyone doesn't know what that is, usually when you're trying to help people get more oxygen, if you're doing CPR, it's called a jaw thrust. So you kind of move the lower jaw forward to help open that airway. So it's literally the same movement.
Exactly. That's so interesting. So people need to be more mindful of some of these like signs and symptoms. Oh man, I'm getting chronic lymph congestion. I'm getting swollen lymph nodes. I don't really know why. I don't really feel sick. I'm teeth grinding. My tongue, like this is something I screen I screen for sleep apnea. Your tongue literally falls into the back of your mouth. I can't see the little dangly, the uvula in the back. And I'm like, okay, well, I'm worried that you have sleep apnea. I need to, or some kind of sleep issue. I need to send you to a dentist that can screen for it. And unfortunately, where I live, I'm in a pretty rural area. I've been sending people places that are 2.5 hours away that have a little more focus on this. It does seem like I said, more people are catching on, and there's plenty of dentists here. I just need to continue networking with them so I can find one that I trust to send my patients to make sure they're getting sleep is so critical. I don't know if you have kids. I don't have kids, but my patients that have kids, like I know that they don't get good sleep in those first few years usually. And I'll tell you, man, everything is better with sleep. If you just can get some good sleep, you can tolerate so much more crap in life. It's like the person that cuts you off, you're just like, okay, who cares? But then the nights that you didn't, oh God, a whole new person. Exactly. So that's why I want to bring this to people's attention, because if the more we can share about these like weird nuances that aren't really being discussed, it makes it easier for people to then start advocating for themselves instead of doing another parasite cleanse. Sorry.
Yeah. It might be related, but a lot of the time
it could be,
but a lot of the times it really is about like jaw structure
I believe
and
it.
also stress plays a really big
Huge.
role.
Oh my
Psycho,
gosh.
yeah, emotional. Oh my God, yeah. Um,
Absolutely. Yeah, I noticed as a person that has a history of teeth grinding, stress, or excuse me, a stressful event, caffeine, too much sugar, or drinking alcohol too close to bed are all things that I have a tendency then to clench more and then grind a little bit more. But I've noticed that for myself. So I then encourage people, again, that self-exploration so they can find the things that kind of agitate their system.
well,
Yeah.
yeah, it's actually drinking alcohol definitely can make sleep issues worse in
Oh,
general
across
on
the
all
board.
across the board, and especially for like sleep apnea specifically.
Yeah.
Um,
Yeah. I get a lot of older folks and they're like, well, I have to have my wine and it helps me sleep better. But it doesn't actually make you sleep better. It makes you sleepier, but you don't get into the deeper, more restful, restorative, healing parts of sleep, REM, rapid eye movement. So you just totally miss out on that. And
yeah,
that's not great for the microbiome health. When you're not getting those deeper, more restorative sleeps, then you are more likely to have dysbiosis. And that kind of pulls
yeah,
us into the oral microbiome and how that can then have effect not only in cardiovascular disease but in other types of systemic chronic illness that we are seeing so prevalent in the United States these days. What
yeah,
what have you kind of seen, or what's your experience with oral microbiome?
yeah. So I've went very deep into the cancer field. So lots of different cancers, especially I see like breast cancer, colon cancer, pancreatic cancer. Those are the main, I would say, the main ones. Even lung cancer that the oral microbiome is connected to, um, but not just certain types of cancers. Also, certain like types of arthritis. I've seen rheumatoid arthritis. I'll tell you a crazy story. So I actually had a patient who had an infected root canal, and he said every morning when he woke up, his knee just he had started getting arthritis in his knee. It was like cracking and painful and that kind of thing. So and the tooth was on the same meridian as the knee, as his
Of
left knee.
course.
Of course, it was.
Mm-hmm.
So long story short, we took the tooth out. The tooth was sent to a lab that. So we directly took it out, put it right into the little test tube, and the lab found really, really high amounts of arthritis bacteria
Ooh.
on that tooth, like really off the charts.
Wow.
But it's interesting because the patient literally told me the next day, he's like, well, I don't have knee pain. It doesn't hurt anymore. It's so weird, and he's been fine ever
It's
since in that
so
knee.
wild.
And
Yeah,
again,
it's
I can't claim that this will, do
that it's
anything
all
more.
cases. No. Everything is multifactorial, but it's worth
Exactly.
exploring because some of the medications
Exactly.
for rheumatoid arthritis, which is a pretty serious autoimmune disorder, are pretty awful, the side effects. And so it, to me, as a person that's interested in this, and I know not everybody is, to explore these other potential avenues as, maybe it is because you got a root canal 10 years ago and it happens to be on the meridian that's associated with whatever. The meridians that Dr. Dianna is speaking to are related to the Chinese medicine meridians that run through our body. Whether you believe them or not, there's a ton of overlap with,
Oh yeah.
certain conditions in the meridian. So in my mind, this has been around for way longer than my people have been on this planet. So 6,000 years, I think, is the amount of written history we have for Chinese medicine. So I give it some credence and I consider it in my practice as well. Like, oh, look at that. You're on the gallbladder meridian. And oh, look, you're having gallbladder issues. Imagine that. So let me ask you about root canals because I feel like this is such a controversial topic. And even the biologic dentist in my area, which we are fortunate to have one here in Montrose, she will still occasionally do root canals. And I know there's always a risk and a benefit, and we have to weigh those depending on the patient sitting in front of us. And I don't really want to lose any of my teeth. And implants, metal or ceramic, and I hear the ceramic ones aren't as stable. So there's so many pros and cons. Tell me a little bit more about root canals.
Yeah. So I think there's a ton of controversy. Most conventional dentists think that they're completely safe. You know, Lots of biological dentists or more holistic dentists kind of can go both ways on it. From my experience, I've from what I've seen, most of the root canals that like if you look at a normal 2D, two-dimensional x-ray, you can't, they look fine. A lot of them, they look like they're not infected. But sometimes when you take a 3D image, like a cone beam, then things that look seemingly completely normal have these huge infections or, so I think one main thing that conventional dentistry needs to do better in is if somebody has a root canal, really monitoring that tooth better with like certain types of x-rays, because they're more likely to be infected. So a lot of dentists,
the cone beam is the one that comes around you, right? It does this kind of like crossover. Oops, excuse me.
Yeah, there's also a panoramic one that does the same thing. So you just have to double check with the dentist that you can do a 3D image of just one tooth too. It doesn't have to be the whole. Yeah, so just kind of monitoring that tooth. If you do have root canals, I think it's really important to monitor them. Not every single one shows an infection on an x-ray. Does that mean they're always all infected? I have no way of knowing that. But a lot of dentists do say that like when they take seemingly normal root canals out, that they're still really infected. So there's a lot of, it goes both ways. So my approach is I give all my patients the pros and cons of all of the treatments, procedures. Like if you lose the tooth, then this can happen. If you take it out, then this can happen, right? It really depends on someone's medical history too. Like, how's your immune system? Like, is it completely healthy? What other medical conditions do you have? Like, are they potentially, can they be related to root canal bacteria? Right. Are you comfortable with the chemicals and the materials that are placed into your tooth? It's not only the infection. I feel like a lot of dentists just talk about, like a root canal is infected. It's not infected. It is. Right. That obviously, if it's infected, we need to treat it and fix it somehow. However, what about those materials? A lot of people, and I think some people, they get relief after you're taking a root canal out. Maybe it's the bacteria, or sometimes maybe it's like, are they allergic to something that's in their tooth? Like, it's really hard to say. So I think it's really an individual call. Am I a huge fan of them? No, but I think some people could tolerate them.
Right. So by providing proper informed consent and understanding that each individual person is unique to their own biochemical makeup and might be allergic to like the ceramic piece or whatever, the other options are. And I love that is how you practice, because that's very much how I practice. And people are like, well, what do you do for this? And I was like, well, it depends on so many factors. And we have to make sure that it's within the patient's capacity to be able to do what we're asking or, manage that, because not everybody's willing to manage their root canals and they just need that thing to be quick and fixed. And then they don't want to have to think about it. That's a lot of the case, but, or individual approach.
If somebody's not able to have their tooth removed at that time for whatever reason, then a root canal, like if there's an infection, you need to do something about it, right? 100%. So then doing a root canal is better than nothing, because you have to just help kind of get rid of the bacteria. But a lot of dentists say that even if you're like really, really good at cleaning out the tooth, there's no way to, because there's so many little micro tubes and stuff like that, and lateral canals in the root of the tooth, that it's really almost impossible to get every single thing. And then what happens is when you do a root canal, you're taking out the blood supply to the tooth. And the way, so what that does is think about all of the important cells and molecules and things that gets transported through the blood vessels. If the tooth doesn't have that blood vessel, it's really hard to keep that bacteria under control. And the only blood vessels are like around the surrounding bone. So it's a very, very controversial thing. So, this could be a whole topic for another podcast, but I think it really depends on the patient. But in general, I'm not a huge fan just because of some of the things that I've seen. Right. But it doesn't mean that, certain people, they could be fine. Right. So,
exactly.
And it really depends on the patient and
per my one class I took in school with a biologic dentist, he's like, you guys at UNDs are like, treat the whole person except the mouth. And so the way he talked about root canals is like the pictures in the book show like the typical tooth root. And what Dr. Dianna's talking about is that it's never that simple. Sometimes some teeth are, it just depends on where the tooth is and the person. There's so many things to take into consideration. And then you get like the teeth further back and they have a little more complex root structures, and you can do the best you can, and sometimes it's just not good enough. Sometimes it is good enough. That's really where like the pros and cons need to be had with your dentist so you can make the right decision. And like, I'm not trying to talk about the controversy. I just want people to understand that there's a time and a place. There's a time and a place for medications, and I'm not anti-med, which is such a common misconception about naturopathic doctors, is that we're super anti-medications, we're against surgery. Actually, in the state of Oregon, when we got expanded scope for naturopathic doctors there, we actually sent more people to specialists because we're like, hey, you actually need to see a neurologist. Like, you come in to see me and you're having something that's a little bit funky, like you need to go see this person, not me. You need to go see a pulmonologist. I recently sent a patient to a pulmonologist. It's like, we understand the complexities and we want to share and help our patients get better. Sometimes they need to go see a biologic dentist, which is often actually.
No, I completely agree. I think there's a lot of things, like there's a lot of times surgeries could be avoided.
Yeah.
That like they're overdone and things like that. But also at the same time, surgeries for certain situations can literally be life-changing and so helpful.
Oh my God.
And yeah, I think it's not saying, oh, all root canals are always horrible for everybody or all surgeries are always bad. I think it really depends.
100%.
Obviously,
it depends.
Most people don't want to get surgeries and things like, so, but
I don't want to get a surgery, but if I have to, my leg is broken, I'm happy that we have that as an option. Thank goodness.
Thank God that it exists, right?
Yes, so I can keep my leg and maybe not die. Okay. So I was reading an article before our meeting, and it's called, and I'll link this along with that Jaws book, Can Oral Bacteria Affect the Microbiome of the Gut? It's a 2019 study published in the Journal of Oral Microbiology. And one of the interesting stats, kind of like random facts about statistics, 45% of the oral microbiome is the same as what we see in feces. That's almost 50%. Like, there's a huge crossover there. So if we're having questionable things in our mouth and we're mouth breathing, which we haven't talked about that yet, but that affects jaw structure significantly. If we're mouth breathing, that dries out our mouth and causes a pH shift. Our mouth is supposed to be neutral pH, a pH about 7, the same as water, give or take a little bit, and everything's always like 6.5, 7.5, somewhere in that range, right?
Yeah.
Tell me.
So, do you want to talk about mouth breathing, pH? There's so many.
Oh my God, tangents. So I thought it was really interesting. I didn't realize there was so much crossover between the digestive microbiome and then the oral microbiome. I want to talk a little bit about that and what you've seen in your practice.
Yeah. There's like a lot of different microbiome testing that there's like depends on the person and the type of like, I guess, conditions they have.
Sure.
But I've seen a lot of like people with colon issues, right, have a lot of Fusobacterium nucleatum, which is like the one that actually is connected with like colon cancer, right?
Mm-hmm.
In
the mouth.
Yeah.
Wow.
In the mouth. There's just in general, just think about it. Like, your mouth is the first stop in your digestive tube, right? So like you said, I maybe it was before we were on camera, I don't remember, but like if you're swallowing certain bacteria, like the dead bacteria can still affect your gut. But yeah, there's so many different connections with certain bacteria and certain gut issues. So
yeah, I was off camera, wasn't it? That was in this same study. The authors found, it was a test tube study, so it's not a human study, so we're extrapolating, but it's still an interesting find that for every 10 cells of bacteria that we swallow that are dead, we will start to trigger increased virulence factor production, so making the bad bugs worse, making them stronger, more durable, more resilient to treatments. And this includes antibiotics, this includes mouthwashes even. Like, I'm curious if mouthwashes have been contributing to antibiotic resistance or resistance in general of certain bacteria, like increasing and making them worse. I don't know. That's a question mark. I don't know if that's true or not, but could be.
There's definitely some talk of that in the dental literature. Another thing, so when you swallow whatever, like in bacteria, I don't know if it's so much like swallowing it. if that's the way it's connected to your gut, because a lot of the acid, your stomach acid, should kind of just dissolve a lot of that kind of thing. But a lot of it gets absorbed in like the blood vessels in your gums and things like that, or if you're like aerosols, like if you're breathing it in into your lungs. So there's other mechanisms that the bacteria can go. That's not only like you're swallowing. So I just wanted to make that clear. Like, it can be through your blood vessels. It can be through your air, like aerosols. So that's why there's a lot of certain like lung conditions that are related to bacteria in your mouth. So
yeah.
Also, Alzheimer's, I know, well, there is a connection with the gut, the lower gut too, and digestion and Alzheimer's disease, right? They're like type 2 diabetes.
Yeah.
They call it now. But there's connections with the oral bacteria and Alzheimer's, also with Alzheimer's and sleep disorder breathing as well. Sleep apnea. There are some connections with mercury too.
That doesn't surprise me.
Yeah. So the mouth, when somebody has Alzheimer's, I mean, the mouth is like, you have to start in the mouth. That's what I believe, because there's so many different possible contributing factors. And like, or for Alzheimer's prevention, like if somebody has Alzheimer's in your family, and really taking control of your oral hygiene, lowering the risk factors from your mouth, treating sleep disorder breathing if you have it. Like, these are all things that you can do proactively.
Yeah. I feel like we've got to talk a little bit about mouth breathing, because it really does shift not only the amount of air that we're inhaling into our lungs, which causes all kinds of long-term health issues, but also it dries out our mouth. And one of the places I start with new patients when they're coming into me for reflux or really any kind of digestive issues is, let's talk about mouth. Not only how you're eating and what you're eating, but how you're chewing it, how you're engaging in that parasympathetic response where you're resting and digesting, but also how are you washing your teeth? How are you taking care of your mouth? Are you taking care of your mouth? Are you mouth breathing? And I joke, the only time I have my patients breathe through their mouth is when I'm listening to their lungs on physical exam. This is the only time, and then I'll go into a tangent if I haven't already told them about mouth breathing. It's just like, talk to me about mouth breathing from your perspective.
Yeah, well, it's really great that you do that for your patients. That's an amazing thing. But in general, so usually mouth breathing, it can be connected to some type of sleep disorder breathing. Sometimes your nose is clogged or there's something, right? But whatever the root cause is really important to address it. But what mouth breathing, it actually could be connected to GERD or acid reflux too, which is kind of cool because of the abnormal forces of like gasping up and down, like from your esophagus, and it just like kind of messes up and it pulls a lot on your uvula, and there's just a lot of abnormal forces that have been known to be connected with GERD. But in general, mouth breathing, it not only can affect like a lot of different diseases related to sleep apnea, but also it, like you said before, it dries out your mouth. It can change the pH, and if your mouth is dry, that means that there's not a lot of saliva in your mouth at that time. And saliva has a lot of protective factors like antibacterial, antifungal properties, right? So then it could put you more at risk for certain cavities, bacteria, gum disease, yeast, like thrush in your mouth, different things like that. So yeah.
Yeah, I hope that the mouth breathing and the shifting of pressure, because our thoracic cavity, I talk a lot about hiatal hernias, and it is very much a pressure differential shift. We're not supposed to have our stomach up in our thorax, right? And so that, you just helped me make that connection that when we're mouth breathing, we are shifting that pressure differential unintentionally. A lot of times what I see with people that are mouth breathing, it's, I think back to Hey Arnold, if you ever saw that show, and like that kid.
I love that show. Yeah.
Like, right, kid with allergies. And the crazy thing is, I read Breathe. What was the author's name? I forget.
That's a great book. That's a great book.
Such a great book, easy to find, easy to read if you're not like super like nerdy about into the science world, and he makes it super accessible. It was on the New York Times bestseller a few years back. I'll put a link in the
that's a great one. Jaws and Breathe, or if you have thinking about sleep disorder breathing, sleep apnea, those are really good books.
So in that book, he talks specifically about the more we breathe through our nose instead of our mouth, which is what our nose is meant for, we actually create less stuffiness. So if you have a history of allergies, and hey, your girl did, I have some used to have some serious allergies. And if you think about it from the perspective of mouth breathing, goes straight into the lungs. You don't get any of this nice protection. We have these, they're called turbinates. We got 3 on each side of our nose, and they circulate through there to also filter, but also warm or cool the air and also moisten it. That way we're not drying out the lungs. We're also talking about reducing COPD, asthma by nose breathing. Nasal breathing. Thank you. I was combining them.
You got it.
It's so important for our overall health. Yes, it's pertaining to reflux, but also if we aren't breathing through our nose because we can't, that needs to be investigated. I actually had a patient. This is a great example of when I went up on the therapeutic order, which is something us naturopathic doctors use to remind us, like, everything is part of the treatment plan. It's just, when do we need to go up the ladder? Severely deviated nasal septum. One of my first patients as a new doc, and he's having really severe anxiety. And I'm like, okay, maybe it's because you can't breathe. And I had never seen a nasal deviation that bad. The ENT he saw said, in my 30 years of practice, I've never seen a deviated septum that bad. So that made me feel like justified in my observation of, this seems like you need to have surgery. And it was pretty life-changing for him. So there is a time and a place, and man, breathing is critical. That's a great time to consider a surgery.
Yeah, you want to optimize your breathing for sure. Yeah. That's not something to mess around with. So
no. Okay. So have you? Let's see. P. gingivalis is the type of bacteria that is most common or so commonly associated with dental caries or cavities. It also seems to be the one I saw that was associated with Alzheimer's. And then my deep dive went into there is an association with Barrett's esophagus, which is, precancerous, but it really rarely ever becomes a cancer. Tell me a little bit about your knowledge of P. gingivalis as a bacteria that could be good or bad.
For the most part, it's not really great. And it is really associated with a lot of certain gum infections, gum disease. It's associated with a lot of different systemic diseases. Yeah. So what I do in my practice is I like to test, for the levels of them. And if they're at really high levels, we can help kind of lower those levels and get them under control.
Yeah.
So a lot of it, it's more, I think it's, from what I've seen, it's more related to gum disease issues.
Okay. Got it.
Gingivitis, periodontitis. Yeah. But okay. The thing with the, like I said before, it's it's not if you have some bleeding gums, it's really important to not just ignore it.
Right.
And there's a whole, we won't get into it today, but if you have bleeding gums, it could be bacterial, it could be vitamin deficiencies. There's all these different things it could be related to, but it's just kind of a warning sign to let you know, because your dentist might not have the ability to do bacteria testing, but a way to kind of know if you might potentially have some of these P. gingivalis or Fusobacterium nucleatum, that's the one with the colon and things like that. It's just checking for bleeding gums. Right? So that's important.
Mm-hmm. Yeah, so we've covered a lot of different things, but really the big picture view here is we're both looking at our patients' care from a holistic perspective, making sure we talk about the foundations for health, which are so important, and there's nothing sexy about it. You got to eat right, you got to take care of your body, you got to get some good sleep, you got to drink water, reduce your drugs and your vices. We all are human, yes, and do the best you can to find a healthier way to cope. There's no supplement for that. There's no medication for that. It's just a fact of being a human. If you want to have a good quality of life, those things are required. And having a good naturopathic doctor and a biologic dentist on your team of healthcare providers to help make sure that you are getting the best care you can from a holistic perspective. Holistic as a word, I feel has gotten a little bit skewed, but we really want to make sure that it's from top to bottom, inside out. I like to say we're all snowflakes. We're all unique and individual in our biochemistry, and it takes an individual approach to our care to make sure sure. And that's what she was alluding to with the bleeding gums. It's never just one thing. You need to investigate the cause and not just assume. Thank you, Dr. Google, and all of the people that love to do that. I love people wanting to help themselves, but you're not always the best. It's not always the best way. So we covered a lot of things. We talked about tonsil stones and enlarged tonsils. Doesn't sound like there's we don't have an answer. Sleep disordered breathing is a spectrum, with sleep apnea being the worst. And so if you've been to a sleep study and haven't been diagnosed with sleep apnea, but there's still sleep issues, investigate further. Find a biologic dentist. Find someone that does sleep disordered breathing, has an understanding there. The oral microbiome and the gut microbiome play a role. And with Dr. Dianna's background in cancer, she's seen some oral bacteria be associated with things like colon cancer and breast cancer, lung cancer, and pancreatic cancer, which is fascinating because pancreatic cancer we don't usually diagnose until it's stage 3, stage 4, 3 if we're lucky, because the symptoms are like bloating, and that's it. So these are just one more perspective to look at things so that we can better advocate for ourselves in a world where our doctors are very busy and they don't always have they have good intentions, but they don't always have the time and mental capacity to pay attention in the 10-minute window that they have to all of these details that we are talking about today. Anything else you'd like to add?
I would say, I guess a really good, especially with sleep disorder breathing. I know some people just say you have been diagnosed with sleep apnea. I'd speak to your dentist, but you might be, sometimes they'll give you like the CPAP thing, right? And it's just, a lot of people can't tolerate it. It could be very helpful for people to help treat sleep apnea. There are sometimes, it depends on your situation, like certain alternatives, like certain mouth guards that just hold your jaw in place so it doesn't collapse and help treat sleep apnea that way too. And I've found a lot of success with that with my patients.
Yeah. Dental appliances is what they're called, right?
Yeah, like sleep oral appliance therapy, I guess.
Okay.
Yeah, and there's all different like brands and materials, and that's a whole other rabbit hole of things. But
for sure.
I just think I don't know if I mentioned that. I just wanted to let people know that there are like a lot of solutions. Like if you do have sleep issues, right? For the most part, right? I can't promise everything, but there's so much you can do that's not, that's not nothing, right? Something is, if you have this issue, something is better than nothing, right? Like
exactly.
Getting better sleep hygiene, getting on a better sleep schedule, things like that can make a humongous difference for you.
Yeah.
And then if you have some of these diseases that we've kind of been talking about, seeing a biological dentist is really important, I think, because a lot of us have like a really like focusing on oral systemic link and how the mouth is connected to other parts of your body. And like, if there's ways that we can help you get control of certain bacteria or in whatever other ways that there might be connections,
totally.
I think, if it can potentially help you, that would be, that's great. Or if you're looking to prevent these things, there's things you can do proactively. I know sometimes I offer some virtual support too for certain people. So you can find me on Instagram or my website. I'm sure you'll link it.
Yeah, I'll link it in the show notes. Yeah. Now this is great. And I say to my patients all the time, a penny is worth more than no penny. I'd rather you move an inch forward than, just not do it because you can't do it 100%. Like that's, we're trying to create simple things for us to remember to become better humans. Like put your floss on the table while you're watching TV. Yeah. Easy.
That's literally the best thing. And I feel like people come back now like, I floss now,
Brilliant. Totally.
Because it's the stupidest thing, but it really works. So
maybe even like with my patient recently that told me she has a hard time brushing her teeth, it's like, great, keep a toothbrush and a spit cup right there at the table and brush your teeth while you're watching TV, because we all do it. Well, maybe some of us don't, but anyway. So
it's so important. So,
we're going to wrap up. Thank you so much, Dr. Dianna. I really appreciate your insight today. Dentists, I had no idea would have such an interest with my specialty in reflux, making sure that I am working closely with good dental practitioners that understand the body as a whole. the mouth doesn't just stop at the mouth. It's attached to the rest of the body too. So if you guys are liking this content and are really enjoying it, like and subscribe. Really trying to get access for you guys to understand the variety of practitioners that are out there, and that we're not all just like crazy people. We really want to help you improve the quality of your health from a practical and functional perspective. And also, we want to prevent chronic illness. Like Dr. Dianna spent time in oncology before she became a private practice dentist. So we care about the whole you and not just blaming it on genetics. Like there is such a bigger picture and a more empowering perspective to take. I'll link her contact information below, and thank you guys so much, and I hope you have a great day.